All right. Hello, everyone. We are back with another episode of the Embracing Joy podcast. And this is an episode that you will not want to miss. So if you're watching live or if you're live, share this episode with a friend so that they can watch live with you or watch the replay at a later time if they're not available. So I have a very, very special guest with me today. We have Dr. Alana Arnold, who is a pediatric emergency room physician. I'm going to tell you a lot more about her, but I just want you to say hello to our audience now while we're
Yes,
here.
absolutely. Hello, everyone. Thank you for tuning in. I'm really excited to be here with my buddy, Dr. Majette.
Yes, it's such a pleasure to have her. So the topic is very important. So we're going to talk about transforming pediatric emergency room care and how, that process currently, pediatric emergency rooms or taking your kid to an emergency room is such a stressful process. You're not sure of the care that they might receive once they get there. So Dr. Alana is going to tell us about her business and what she's done to transform that experience, as well as embrace joy throughout her career. So let me tell you a little bit about her. Dr. Alana Arnold, she's a board certified pediatric emergency medicine physician, and she serves as a network director. She oversees 11 emergency rooms and urgent care centers, and she's also the CEO of PEMPals and Parent Partners. That's her pioneering work, which centers on advancing pediatric care in the community as far as community emergency rooms and in urgent care settings. She equips families so that they can have these vital health literacy skills to have the best outcome for their patients. So she's seen that children have 4 times more likely to experience fatal outcomes in non-pediatric hospitals. So what that means is in hospitals where they do not have a pediatrician or someone who's completed their residency or MD covering that hospital, they're more likely to experience a fatal outcome. So she's dedicated to enhance the capabilities of emergency care providers so that they can deliver expert pediatric care, even in settings without those specialized pediatric resources. So through her PEMPal, she has developed a web-based platform which features clinical simulations and educational videos that provide non-pediatric trained clinicians with immediate evidence-based guidelines for pediatric emergency medicine. And her initiative, she has had improvements in clinical performance, reductions in morbidity and mortality, and significant cost savings across the healthcare system through her web-based platform. She's a passionate advocate for children's health equity, and she founded Parent Partners, a health literacy program. So she's also done, in addition to everything we stated before, she also has a literacy program for families, especially those that are in underserved or communities, so that they can reduce health disparities among children. So through access, evidence-based programming, Parent Partners empowers families to navigate and support their children's health confidently. She's also a sought-after speaker, and she speaks on panels and podcasts like ours, where she addresses the urgent need for health literacy to benefit the 30 million children who pass through the ERs annually. And she's helped reduce the $730 million annual cost from unnecessary emergency room transfers and pediatric malpractice cases. She was born and raised in Philadelphia, and she completed her undergraduate studies at Princeton University and attended Tufts University School of Medicine in Boston. And she pursued her pediatric residency at UCSF. I don't know how to pronounce Benioff Children's Hospital in Oakland. And she's also completed a prestigious fellowship in pediatric emergency medicine at Texas Children's Hospital in Houston, which is the nation's largest freestanding children's hospital. So she's shown, through all of this, she has shown dedication to providing a multifaceted approach to caring for our children. So it's such a pleasure to have you. And this topic is important for all of our people with children. So our target population is high achieving professionals. You know, a lot of them have children. A lot of them, you know, want to imagine a better place for their children, or if they have a pediatric emergency, they want to know that they're cared for someone who's trained to provide for them. So it's such a pleasure to have you on and to discuss like empowering patients and saving lives and also a little bit of your career path as well. So
Yes.
thanks for coming on with us today.
Yes, thank you so much. Thank you so much for having me. It's, you know, a huge passion of mine to just make sure kids are getting the proper care that they need. And I think, you know, I've found as I've gone through my career that even in medicine, a lot of physicians, unless they are, you know, in ERs or in pediatrics, they're not aware of these huge gaps that exist. I have, you know, a friend who's a pulmonologist, actually has children, but they have the luxury of living in a city where they have a large children's hospital, so their default is always going there. And the real issue is that, you know, you and I know that there's only a minority of children's hospitals in the country. If you look at all of the hospitals, only about 5% of them are dedicated children's hospitals, and the rest are general hospitals. So you have a lot of kids that still pass through these centers or their ERs. And the last figure I saw was nearly about 85% of kids, when they're initially ill, they go to the closest facility, which is going to be a general hospital. And that's where they can get into trouble because these clinicians, again, I have a lot of friends who are ER doctors, very competent, but they have limited exposure sometimes to the sicker kids. Unfortunately, just how residency is formatted. About in a good residency, if you're attached to a children's hospital, you could rotate in a children's ER, but most residencies are general hospitals, and maybe about 10 to 15% of their training focuses on kids. So then it's a hard gap to fill when you see kids that account for about 20% of all ER visits, and you might have sicker kids. So they completely look differently when they're sick, have different vital signs, have different medical issues that come up. And we all know that, right? You can't ask a baby like what's going on. Like it's a completely different skill set that you need to build up. And so PEMPal really focuses on helping these clinicians have the tools at bedside to deliver the best care possible. So I'm really excited that the clinical decision support tool that we're developing actually interfaces with the electronic health record so that it's all kind of seamless and all in the workflow for the clinician so that they can access evidence-based protocols, even if they're in like a very rural setting or not near a children's hospital, because that's where they can get into trouble where they don't have someone directly there who has the pediatric training to help treat and then stabilize the kid.
Wow. So I think, you know, I trained here at University of Miami, Jackson Memorial, you know, Holtz Children's Hospital, and we have a pediatric emergency room. And as a family physician, we've had, as part of our residency program, we spent a significant amount of time inpatient and pediatrics and in the pediatric emergency room. But I never thought, you know, you don't know what you don't know, right? So
Right.
in that case, so you may not know that children are also being brought to hospitals that don't have a children's emergency room
Yeah,
because you don't
100%.
even
Because
realize
it's just
that.
a numbers game. Yeah,
Yeah, you don't
because
even realize
that's
that there's
something.
places that don't have a children's emergency room. Yeah.
Absolutely. And that's the majority of facilities. Because, like I said, like we had the benefit, I trained at a children's hospital, you had exposure to a children's hospital, your rotations were all there. But the majority of clinicians, the ER clinicians, and this goes for, you know, there's PAs and Ps that staff ERs and urgent cares, they don't have that direct link to a children's hospital. It's not mandated. They might have a rotation here or there, but there's not a robust amount of training that they have. And so, you know, especially when I was in fellowship, we would get transfers all the time from outside hospitals, suburban hospitals, other hospitals in the city, because especially as a parent, when you're concerned or scared, you're going to the nearest hospital, right? And that's very, very often not going to be a children's hospital. So that's where you're going to see that disconnect in terms of the clinical care.
Mm-hmm. Wow. So yeah. So you've kind of told us a little bit about how your work with PEMPal kind of bridges this critical gap that exists between the community ER emergency room. So say someone that's listening or watching and they're in a place that the nearest children's hospital is an hour away or 2 hours
Yeah.
away. And if their kid is sick, they may go to an urgent care, but even the urgent care is adults only, right?
Yep. Yep.
Adults only. So then how does your app kind of bridge that gap? Or
Yeah.
PEMPal, I'm
So
sorry.
absolutely. So PEMPal is designed for the clinician, and Parent Partners is designed for the parent or the family. So talking about PEMPal, it's hospital facing. So we engage with hospitals, ERs, urgent cares, so that there's three areas that we do. We have in-person as well as video clinical trainings that we do to upskill the staff. We have CME and CE accreditation, so you can rack up your CME credits as well. So it's like a win-win for the facilities. And the key there is to meet the clinicians where they are. I'm not expecting everyone to be an expert at pediatric medicine, just as I'm not an expert by any means in adult medicine. The goal is to give them real clinical scenarios that are going to tell them what to look for in terms of, common things like asthma, respiratory distress, how to deal with SVT, for example, in a baby, those signs and symptoms. So we have all of these clinical modules that allow them to get that education. And we have video content as well. So if you can't do in person, we have the content in video form. They're very short form videos. No one likes to sit for like an hour lecture. So it's tailored to the ER and urgent care environment where you get all the information you need, medication-based dosing, because kids come in all different sizes, all of those important things. So that's the first component that we do. The second component is the clinical decision support tool. So this is really key because most facilities, and I saw this even while in Miami, and you can relate that even in a major city, if you're not at a children's hospital and you don't have a direct partnership with them, people are practicing medicine based on how they train. And so a lot of times what I found is that these facilities do not have evidence-based standardized practices for kids. So asthma is something really common, right? So I know exactly what I need to do in terms of dosing and escalation of care, say in a 4-year-old, but not every clinician knows how to do that in an ER and urgent care setting. So the clinical decision support tool that we have allows them to access within their work environment. So interface directly with the EHR to click our icon essentially, and then go to the asthma treatment plan or go to the bronchiolitis treatment plan so that they have step-by-step information as to how to manage those patients that are directly in front of them without having to have someone like me physically there. So it's really important to make sure that those clinicians feel supported and have the tools necessary to take care of the patients that they're seeing right then. And then the third component that we offer is really advisory. So we can discuss deficits in terms of like equipment and supplies. A lot of these places don't have even proper supplies. I've had issues where a sick child needs to be intubated and no one has the proper size endotracheal tube because it's a facility that does not see children regularly. And it's like when you need it, you need it. You can't second guess having the proper equipment for children. And we do things like making sure that they have appropriate supplies, equipment, as well as just making sure they have ancillary equipment, properly sized blood pressure cuffs, all those little things that people don't think about when you're dealing with children, because children do come in all different sizes. So those three components really um, are the basis for PEMPal, and we have been able to demonstrate that it's really a win-win both clinically and financially. We've been able to demonstrate revenue recapture because once the staff is trained better, you can see faster and larger volumes of patients and actually get better reimbursements when you're delivering the proper care. And then secondarily, you're not sending as many kids out of your system. So many transfers I've gotten where, it's an urgent care sending them and they say, oh, there's, a a a bead stuck in this kid's nose. We don't have the proper device. We also don't know how to approach this kid. We can't sedate them because we don't have the bandwidth and send them. And the device that they need may cost $10, but that's a patient that they lost out of their system and also had to pay for EMS that they can now recapture with our appropriate training. So it's really demonstrated that this is a value add in terms of the clinical care. The staff is more confident and feels better about the care they're delivering. And then the third component I want to mention that it can often be overlooked. You know this now, Mac, because you're a mother now. Moms make the world go round. So, like, if you deliver good care to Junior and mom is satisfied with the care, she's going to be that referral to send auntie, uncle, grandpa, whoever to your facility. So it augments your patient base once you're delivering better care without you having to do more marketing for your health system. So it really is a win-win in every way you look at it.
Hmm. Yeah, so I think we've gotten into a lot about how it helps like the healthcare system and the clinicians. But as a mom or someone, maybe or we have some of viewers watching, and of course people are going to watch this later. As a mom, you can feel very overwhelmed with having
Mhm.
a new baby, even when so part of it is sometimes all the conditions that could possibly be, right? So some physician moms, all the possibilities of like, oh, they're coughing, maybe it's pertussis, no, it's just a simple cough, so
Yeah,
all the possibilities of what can be when you're a physician, or you may consult Dr. Google, right? And Dr. Google
yeah,
tells you, oh, this your baby's cough, it means that, they have this pneumonia. And you're like, no, it's just a simple cough. And,
right.
parents really need that reassurance sometimes so that they can embrace more joy and enjoy like the day to day with their babies and the different milestones that they may meet. So, and know that when they do have concerns, they can go to a place that they have, that there is evidence that will answer their questions and provide that
hmm
reassurance and evidence about what's happening. Um,
Yeah,
tell,
absolutely.
tell me about what was your vision and what problem were you really trying to solve when you created that Parent Partners?
Yeah, so I mean, you hit the nail right on the head. So I'm in the ER. Truthfully, probably about, we can say, a third to 40%, depending on where you're working, of the ER volume is mostly general pediatric stuff, right? And so we are seeing families constantly that are either, you know, not able to get into their pediatrician in a timely manner that makes them feel comfortable, or they simply don't even have insurance, and like access is a huge issue. So we see a lot of these general pediatric concerns. And I wanted to address this to try to bridge this access gap and health literacy to make families feel more comfortable and kind of competent and confident around their kids' health. So now everybody has a smartphone, and you and I both know, it takes a bit of time to grow a physician. You can't just snap your fingers and have, more people in the workforce. There are shortages. People are retiring, leaving medicine at alarming rates. And so I wanted to develop a solution with Parent Partners that addresses this, to meet the families where they are, to help give them vetted, evidence-based medicine that is medically sound without going to TikTok University, for example, or Dr. Google. And so the reason why we developed the app is to give them that access and that comfort. So currently in our app, Parent Partners, we have multiple programs in there, and they focus on kind of bread and butter general pediatrics. We have content around neonatal care, so from birth to like toddler years, talking about developmental milestones, postpartum depression, especially in Black and Brown communities, that's often overlooked. And all of this content that is right there at the fingertips of the family. We have the content actually in Spanish as well, so we're really lucky to get that translated, so that we can have more access. And it's designed to be understandable and bite-sized so that anybody is going to understand it. So we have short form videos, literally like 1 minute, that talk about asthma or what you should do in terms of a flare up or signs and symptoms to look at, all in a way that the families can understand it. Because
Mhm.
the pediatricians are doing an excellent job. It's just that they're not given the bandwidth, right, to have, 10 visits in a month, for example, with a family. So Parent Partners really focuses on, it's self-paced. The families can go at their own pace through all of these programs and have the video content to understand, okay, what is obesity? and nutritional eating, and how can I kind of adjust my diet so that I can avoid these issues in my child, or mental health issues. We all know that there's different cultural competencies and cultural issues that come into play with even identifying mental health issues, anxiety, depression, etc. So from my standpoint, it's like giving the families tools to feel empowered so that they know about what's going on with their child and feel engaged and connected with them, even if they're not in the clinic setting. And it's been
Hmm.
very rewarding to see families connect better, to understand what's going on with their child. I know you can relate, like, I'm in the ER and it's like, okay, what medical issues does your child have? Some of them aren't even sure. You ask them and they might not understand really what asthma is or why it's so important to manage it appropriately and have follow-ups and all those types of things. So parent partners, it's a subscription base where you can sign up. We have content where we have group visits as well, kind of smaller settings so that families feel a little more engaged and kind of intimate connections to answer any questions they have. And it's self-paced, so it's been excellent. And there's also chat features where you can engage with the healthcare team too. So it's been something that I'm very proud of, that we're slowly building and partnering with different clinics to get the exposure to families.
Hmm. Wow. So in this age of like information overload and there's information coming from every which way, right? How does parent partners, how is it different, right? Because someone can always pick up a parenting book or
Hmm.
feel like they can search the information themselves. Um, what
Yeah,
what really makes it, different in
I,
terms of like how they get that yeah, how it makes it
the
different.
information. I think the standout is that you can trust us, right? Because you
Mhm.
can Google whatever you want. You can go on TikTok, and these are people who don't have the training that we have. So it's trusted content based off of guidelines from AAP
Mhm.
and vetted children's hospitals, so that you know that you're getting the best true information about the condition. So that's number one. The second
Mhm.
thing is ease of access. Everybody has a smartphone. It's on an app and it's self-paced. So you can take a look at how do you use an inhaler, for example, when Auntie has your son right in there having an asthma flare. So it's like real time access from a vetted, trusted source. And then the
Mhm.
third thing are the ancillary services about like the group visits with the health team to make sure that there aren't any issues in terms of comprehension or gaps in care that are still hanging up on the family. So it's kind of like that threefold high touch that you can do. And it really does help build community for the families, because a lot of people, it's hard to manage, especially if you have a child who's chronically ill or
Mhm.
has like a chronic medical issue. And so building that community in these cohort group visits is really, really important, because families feel supported, and it's a win-win for the clinic because it builds patient engagement, decreased rates of no-show, because that's an issue, because if the families don't
Mhm.
understand why this is important, it's not going to be a priority to go to those visits. And we've been able to demonstrate like better reimbursements and things like that because of better engagement around these medical issues.
Mhm. So, my next question is about like what do you hope to see? Like, what do you hope to see as far as like the change in the emergency room visits or pediatric acute care? Like, what do you
Yeah,
imagine? What would you hope would be the best outcome overall in the next
my
10 years?
yes, my hope and wish and dream of all dreams is that every single child in this country, wherever they go, whatever ER, urgent care, whatever hospital, is that they are getting standardized evidence-based care. That is my hope, because the information is out there, the competencies and science, it's all out there, but it's just siloed. And we have to bridge that gap of access. It doesn't matter if you're in rural Idaho or in DC, every single child should get access to the best care possible that we have available. And PEMPal facilitates that, because again, these clinicians, they're great clinicians. It's just that they don't have the tools. So if you don't have pediatric training, you're not going to know what you need to stock for certain equipment and supplies. And so PEMPal is really bridging that gap to make sure that even in a quote unquote limited resource setting, that you have the basics and can stabilize that child and get them to definitive care. That would be my biggest wish, that every child gets the best care possible wherever they are. And in regards to parent partners, I would say the same goes for parents and families, that we are helping support them gain better medical knowledge so that they can help their child grow and develop into a happy, healthy adult that's going to be contributing to society.
Yeah. Wow. Like, I definitely can imagine that, especially as a new mom with a newborn. You want
Mhm.
to know that when you're taking them to the emergency room, that they're not going to face harm as well too, right? So
Mhm.
when clinicians are not educated in pediatric care, they can actually harm, unintentionally,
Absolutely.
right? And like you said, with
Yeah,
malpractice, so that would be, maybe it's giving the wrong dosage, right? So your baby
absolutely.
goes in with the, God forbid, you take your baby into a place where they don't take care of children, and the baby has a fever, and someone gives them Tylenol, but the dose is not calculated for their weight and
Mhm.
height, the same, their weight, the same as it should be, or
Yeah.
whatever that case may be, or for whatever medication, or they may not have that resource that you discussed.
Mhm.
With that being said, you want that you want to know you're taking your kid to the best hands, to someone
Yeah.
who's well trained, who knows how to care for that kid. So I think
Mhm.
what you're doing is really important, and I'm glad that you were on today.
Thank
And
you.
we just want to sit and imagine, a healthcare system where pediatric emergencies provide that preparedness, where the team is ready and prepared to see your child,
Mhm.
where they're able to go into that life-saving action. So with that being said, we're going to do our wrap-up questions, which are, who is a model of joy for you in your life, doctor?
So I would say my mom and my late aunt. My aunt Marion was literally like one of the most fun people I knew.
Mhm,
She was always ready for a joke, always great, kind of bubbly personality, loved, like when they say like a love of life, that was her. And I
mhm,
really, because she did not have, an easy life. There's ups and downs with anybody, but she always found the silver lining. And I think
mhm,
channeling that, no matter what your situation is, being, grateful for your health and peace of mind and all of that is so critical. So I would definitely say my Aunt Marion and my mom, they were sisters. And so my mom is that way too. So I would say those two people are excellent examples of that.
I like that. So if you were cooking a cake of joy, what would your top three ingredients be and why?
Yeah, so I would say for me, like uh, curiosity and love of learning are huge because it's kind of like an adventure and like a discovery. So having that motivation and interest is really, really important to me. Um, Having a great sense of humor is super important as well, especially dealing with kids. You have to build rapport really quickly. So I have found that that's very, very important to instill happiness, even if you're having a rough day or a rough shift. And then lastly, I would say self-love as well. So being accepting of yourself, loving yourself, making yourself a priority is critically important to your happiness because, you can't go looking for happiness outside of yourself until it's
Mhm,
within, from my opinion. And so
mhm,
that's really, really important to do.
Very wise. So it's been such a pleasure to have you on today. There is well, we have a game as well. We didn't do it in the
Okay.
beginning. Sometimes we do it in the beginning, sometimes we do it in, but it's an improv game.
Okay.
and we'll wrap it up with our improv game, which is called Convergence.
Okay.
So you will just say, you'll say the first word that comes to your mind, and I'll say the
Hmm.
first word that comes to my mind, and we see if we can say the same word.
Okay. Interesting. All right.
Okay.
Yeah.
So like
Yep.
on the and then, so once you say a word and I say my word, if they're not the same, then we try to say a word that connects the two.
Okay. All right. Sounds
Ready?
good.
All right.
Yep.
So on the count of 3. 1, 2, 3.
Beach.
Magic beach. Okay, something that connects magic and beach together. Okay, ready?
Uh-huh.
1, 2, 3. Waves.
Parties.
Waves and parties. Okay, something that connects parties and waves together. Ready?
Okay.
3, 2, 1. Yacht.
Holiday.
Yacht and
Close.
holiday. Okay, something that connects yacht, holiday and yacht together. Ready?
Okay.
Um, Island. I don't even think I
You
counted
didn't
to 3.
count. You didn't
I
count.
didn't even count. Okay, ready? Okay, something that connects, what is it? Yacht and party. Okay, yacht and party together.
Yeah.
Okay,
Okay. Yep.
ready? Okay, 3, 2, 1.
Music.
C. What'd you say? C. It's a C. What did she say?
Music.
Music. Oh yeah, that was a great one. That was the best one. Okay, music and C. Let's see if we can
Music and
connect
see.
those two.
Okay. Music and see. Okay.
Hmm.
Now
All right.
I got the giggles. Okay. Music and
Yeah, I know.
see.
Okay.
You gotta count down, Max, okay? Because
Okay,
you're
I know
gonna have to
out
like
loud. I know for you because you're my friend. So I'm like, she can read my mind. I'm counting in my head. Okay, 3, 2, 1.
boat.
You said food.
Boat. I don't know. A boat.
What was it? A boat? Oh, a boat.
You
Yeah.
didn't even
I
say one. We're done.
didn't
We're
even say
finished. You didn't.
All right, we're done. We're done. Okay. Well, it's a fun game. So the
Oh
game,
my God.
sometimes we get to the same word, but today it was going to
Yeah.
be a lot longer so that we time it. Like it just, yeah, we didn't get to the same word today. It's a fun game to
It was fun.
just, say the first thing on your mind and to loosen up. And we
Yep.
got some
Yep.
giggles in, which is always a win.
Absolutely. Yep.
So
That's a bonus.
if you are, for everybody listening and that's on today, if you want to you want to learn more about PEMPal or parent partner. So PEMPal is for the clinicians, for the healthcare
Hmm.
system
Yep.
that are interested in that program. Or if you want to learn more about parent partners for all the parents that are listening, how can the audience find you?
Yes. So we have two websites actually. So PEMPal, PEMPAL.co, and Parent Partners, the same parentpartners.co. You can check us out there, or simply you can find me on LinkedIn. So Alana J. Arnold, as well as our link tree. The link tree is probably the easiest because everything's housed there, and then you can decide where you want to go. But you can check us out for PEMPal. Anyone who's a clinician or hospital facing, especially the executives. It is really important to, make the argument both clinically and financially that it makes sense. And then for any parents, aunties, uncles, just anybody who is interested in building their healthcare literacy around pediatrics, making sure our kids are taken care of, parent partners would be where you want to go.
All right. And I put the information there in the banner. You can see it's the PEMPal link and also you want to reach out to Dr. Alana individually, you can reach out to her on LinkedIn. Thank you all for joining today. We're going to wrap it up. Please
Right.
share this episode with a friend. Make sure that you sign up for the newsletter so you'll be updated with the latest episode and the next one. And such a pleasure, Dr. Alana.
Thank you so much. It was so much fun. Thank you for
So
having
much
me.
fun. Okay, bye.
Bye bye.